Jonas Salk created the first ever polio vaccine and is one of the greatest medical researchers in our modern era. Polio mostly affected people with weak immune systems who contracted the disease from an infected patient's bodily fluids, and from 1950 to 1955 there were nearly 6,700 deaths caused by polio. Salk's ability to understand that the way to solve scientific issues is to reach out to the media and include the public in the scientific process changed the approach scientists take to create cures and vaccines. Paralytic poliomyelitis is a disease that attacks the nervous system. It causes varying degrees of paralysis and is easily transmitted through bodily fluids. Infants and children are affected the most. Patients tend to be most vulnerable in the acute stage of the virus, which is when the virus is destroying motor neurons that control the muscles connected to swallowing, breathing, and the movement of limbs. The poliovirus can destroy up to 60% of motor neurons before signs of paralysis start to show. Peg Carrot, a poliomyelitis patient, said, "I was sick for 3 days before my parents could get me into town to a doctor. By then my legs were paralyzed and I had trouble breathing. When I got to the hospital, I went to the iron lung right away, and they couldn't start the hot packs and muscle stretching until I came out. Hot pack application, stretching, and muscle massage were not introduced in the United States until 1940. Such procedures were said to be unconventional and controversial, but later became standard procedure." Another patient with polio, Larry Alexander, talked about his treatment while he stayed in the hospital. "I had no idea how painful the treatment could be. I'd fight to control myself, but inevitably I'd end up screaming. She, his nurse Elizabeth Kenny, would actually pull up the pectoral muscles, getting her thumb underneath, and tormenting and pulling, stretching them to their limit and then beyond. I knew it was for my own good, but I dreaded each visit, and oddly enough, as much as it hurt during the treatment, afterward I seemed better." Before the vaccine, patients with this virus had to go through a lot of pain, but since the polio vaccine, the numbers have dropped dramatically. In the 1950s in the U.S., there were more than 60,000 cases of polio, and today there are almost none. Jonas Salk changed the game of medicine forever. Salk took a different approach on his now well-known vaccine. He said, "I pictured myself as a virus or a cancer cell and tried to see what it was like." When the paralytic poliomyelitis virus spread, Salk invested himself in finding a vaccine. At the time, scientists only made live virus vaccines so people would build an immunity to that virus. Sometimes the live vaccines were causing cases of its virus instead of preventing them, so Salk decided to use a different technique. He created a killed virus vaccine instead. The development of this vaccine was different. Several samples of strains of polio were grown and then deactivated or killed with formaldehyde. The vaccine would then be injected into a non-infected candidate. Salk's vaccine could immunize people without risk of infection. By 1954, 2 million children had participated in the field trials of the Salk vaccine. This was only beginning for the poliomyelitis vaccine. President Dwight D. Eisenhower, Franklin D. Roosevelt, and many more believed in this vaccine. I am happy to join with millions of other Americans in supporting the drive for polio vaccination this spring. In 1954, 2 million children participated in the field trials for the new Salk killed virus vaccine. In 1955, success of the trials was announced by Dr. Thomas Francis, where he said the vaccine worked, it is safe, effective, and potent, and doctors began distributing it to protect people against poliomyelitis. Although many people believed in this vaccine, there were quite a few who thought of Salk as a mere kitchen chemist. Those who considered him incompetent were actually fellow scientists who called Salk's vaccine dangerous. They thought his vaccine was causing polio instead of preventing it. Another reason the scientific community did not support Salk was because of the way he reached out to the public. Salk interacted with the public in ways that scientists had never done before, and they accused him of crossing the line of academic decorum by soliciting media attention. Doctors and scientists on staff of the National Institute of Health in the 1950s believed that Salk's vaccine was causing polio because of their statistics from the number of cases since the Salk vaccine came out. In Vermont, the number of cases increased by 266%, Rhode Island by 454%, New Hampshire by 230%, and in Connecticut by 642%. Many said it was worthless as a preventative and dangerous to take. Some health departments even banned the inoculations. An Idaho State Health Director said, "I hold the Salk vaccine and its manufacturers responsible for the increase in polio cases since the release of his vaccine." Salk retorted that when you inoculate children with a polio vaccine, you don't sleep well for 2 to 3 weeks. Not only did Salk have issues with scientists and health officials doubting his vaccine, but he also had a competitor. Salk's biggest scientific rival is Albert Sabin, another scientist who also did research for the polio vaccine. Albert Sabin was taking the opposite approach of Jonas Salk, as Sabin strongly believed that a live vaccine would be more superior to a killed vaccine. Even though Salk came out with his vaccine first, Savin had been researching a polio cure for years before Salk entered the picture. In an interview with Savin conducted by Saul Benison, Savin defended that his vaccine, but still said a few nice words on Salk's behalf. Jonas Salk really took it on and did a very energetic job, and he very quickly got out in front of his field because of the well-organized effort on a large scale, and he forged ahead, said Savin. The reason for the rivalry between the two was the uses of their vaccine. When Salk's vaccine came out first, everyone rushed their children to get the vaccine when it was declared safe and effective. Then later, Savin came out with his oral vaccine, and the population switched to Savin's vaccine instead because it was cheaper, easier to distribute, and easy to administer. Salk did not even patent his vaccine. In an interview conducted by Edward R. Murrow, an American broadcast journalist, he asked who owned the patent. Well, the people, I would say, replied Salk. There is no patent. Could you patent the sun? Lawyers investigated the possibility of patenting the vaccine, but never pursued it. The people were the reason for Salk's success. He reached out to them in ways that were never done before, and he paved the way for communication between scientists and the public. Before Salk, there were typically 20,000 to 40,000 cases of polio a year. In 1952, one of those cases was Kerry Jacobson. He contracted bulbar polio at 7 years old. He was put into a contagious unit in the hospital, but after 3 weeks he was no longer contagious and could start rehab. His right leg and right hip were impacted along with his breathing, swallowing, talking, and articulation skills. Even though he fully recovered, others were not as lucky. In the past, the world was not friendly to polio victims. They were criticized for their disabilities. Even for those of us lucky enough to avoid visible paralysis, keeping up requires a huge effort, said Jacobson. Many people who survived and returned home were discouraged and discriminated against. Some were influential leaders who were part of the disabled right movement, like Franklin D. Roosevelt. Their message was that a disability is a social and civil rights issue, not just a medical problem. For centuries, disabled people have been locked up in state-owned or state-subsidized institutions. We will never know how many lives were wasted, how many intellects stole, how many souls murdered through that system. The people who began and ran this system were good people who thought of themselves as reformers, helping the helpless, but they never asked us what we wanted, said Mark O'Brien. Jonas Salk started the long journey in ending this deadly disease in the United States. Salk's start on the polio vaccine and his other medical contributions after changed medical history. The scientific community and the government changed oversight of vaccine development and the surveillance of clinical trials for vaccines and drugs, designs of laboratories, facilities, and the nature of rehab. The Salk Institute for Biological Studies was created in honor of his ability to turn a dream into reality and to create a collaborative workplace for fellow researchers. Even an annual immunization week began in 1977.